Uh, hello,
Yeah, huh?
hello. I'm thrilled to introduce our next esteemed speaker, Dr. João Marcio, a visionary in the realm of geopsychiatry. Dr. João is set to unravel the groundbreaking insights surrounding the Cape Vulnerability Index, an innovative approach that bridges the gap between geography and psychiatry. With pioneering research, he has delved into the delicate interplay, very intricate interplay rather, between environmental factors and mental health vulnerabilities. Join us in exploring how the Cape Vulnerability Index eliminates the dynamic relationship between the geographical elements and the susceptible to psychiatric challenges. This promises to be a very captivating journey into the intersection of geography and psychiatry, offering fresh perspectives that redefine our understanding of mental health in a geocontextual framework. Over to you, Professor.
Thank you very much for your kind introduction and for the opportunity to meet my dear friend Chris and also Heiner and all the other speakers. I was with Hans in this last presentation. But today we are talking about geopsychiatry this is the outline of the presentation. I'm going to first introduce this field of that is, as he said, is a field of interaction between geography and psychiatry. Then I'm going to introduce this CAPE index, followed by the results of the CAPE Global Report, the CAPE Index applied to the role world. And then I'm going to focus more on Latin America. This will take more the largest part of the lecture, talking more about Latin America. I am Brazilian, and of course that we are trying to use CAPE here. So what is geopsychiatry? Geopsychiatry is developing field which studies the interface between geography and psychiatry. The main focuses are on effects of climate change, disasters, globalization, population growth, movements, urban agglomerations, agricultural production, industrialization, geopolitics, socioeconomic transformation, and also cultural practices. And for this reason, it's a really intersectoral field that can involve professionals from different areas like geographers, physicians, anthropologists, sociologists, doctors, not only psychiatrists, psychologists, architects, urban planners, economists. So it's a really, truly intersectoral field. And geopsychiatry is really in line with the biopsychosocial model. This model, which is it was developed by WHO, tried to explain health and illness and healthcare delivery through biological, psychological, and social aspects, and all the complex relationships among these dimensions. And so geopsychiatry, we believe that serves as an excellent example of this field. Other close and intersectional scientific areas of geopsychiatry involve like medical anthropology, social psychiatry, health economics, cultural psychology, social epidemiology, for example, social psychology. So it's medical geography as well. So we have a lot of other intersectoral areas that can dialogue with geopsychiatry. But geopsychiatry hot topics include examining the causal chain involving the geographic risk factors and incidental mental and substance use disorders. in addition, this field also searched for the protective factors, the environmental interventions that can have been also investigated and implemented. So the CAPE index is just is an index that was developed under this field of geopsychiatry. The name is the Compassion, Assertive Action, Pragmatism, and Evidence Vulnerability Index. It was an index, a global index that highlights the need for assistance in countries with a high degree of vulnerability. So the index is composed by 9 items that I'm going to go into more detail. And it offers some data for assessing vulnerability in each country. So these are the items. The items are life expectancy at birth. This data is extracted from WHO database. Disability adjusted life years, which is a metric extracted from global burden of disease study. The index of doctors per person, which is derived from World Bank database. Gross domestic product also, which is derived from the International Monetary Fund. The Gini coefficient, which is a statistical tool used to measure income inequality. We also have the current conflicts, which is also a metric used in the index. Number of refugees by country of origin. The corruption perceptions index, and the last is the external aid received. So I'm going to give more detail how we calculate CAPE, but these are the nine metrics that we use to compose the item. We know that each of these variables, positively or negatively, are associated with the prevalence and the incidence of mental disorders. And we can have and give examples of each one of the item and the association with the incidence and the prevalence of mental disorders. And so the idea was to compose a global index that can assess a global vulnerability. So the idea is to try to identify which are the countries that are in the most needs for external aid. And so this is the idea of the index. I'm starting showing you some global data, this CAPE global report. So we analyzed data from 193 countries in total, and including 47 from Africa, 35 from the Americas, 53 from Europe, 27 from Western Pacific, 11 from Southeast Asia, and 21 from Eastern Mediterranean. Of course, that we were not able to calculate this index for all the countries, because many countries doesn't have some of the index that are the items that are used to compose the index. So after exclusion, we have only 137 countries, and we ranked the values for each CAPE item. So for each CAPE item, we have a ranking of the country with the most difficult in this item. So for example, the country with the lowest life expectancy at birth, or the country with the lower, for example, the highest corruption perception index. And then we ranked and we selected the top 20, those who are in the top 20 to score on this item. And I think that not surprisingly, these are the most vulnerable countries. So we have 23 countries that scored, that were at least in 4 of the top 20 for of the 9 items. And so which are these countries? So we have 4 countries in Latin America. We have Honduras, Colombia, Haiti, and Guatemala. In Southeast Asia, we have Myanmar. And in West Asia, we have Iraq. 17 countries in sub-Saharan Africa, namely the Central African Republic, Mali, Ethiopia, Cameroon, Sudan, Guinea, Zambia, Mozambique, Lesotho, Nigeria, Rwanda, Niger, Burkina Faso, Chad, Benin, Azerbaijan, and also Côte d'Ivoire. And as we can see here, this table presents the prevalence of mental and substance use disorder among these 23 countries, with the most vulnerable countries. And the average prevalence of mental disorders was 12.45%. The highest prevalence was in Sudan and the lowest in Azerbaijan. And regarding substance use, we found an average of 1.7%. Highest value was found in Guatemala, 3.6, and the lowest 0.7 in Sudan. This other table presents the prevalence of mental and substance use disorders on the 23 opposite countries, those with the highest quality of life index, including the most wealthy countries that you know, so Australia, Austria, Canada, Czech Republic, Denmark, Estonia, Finland, Germany, Iceland, Japan, Netherlands, Norway, Oman, Portugal, Slovenia, Spain, Sweden, Switzerland, United Arab Emirates, UK, and United States. And there were no countries from Africa. And the average prevalence of mental disorders was indeed higher than those at the highest vulnerability, was 15%. The highest prevalence was found in Australia with 19, and the lowest in Japan with 10.5%. And also for substance use disorders, we have a higher prevalence with 3.5 for substance use disorders, with the highest in the US with 6%, and the lowest in Oman with 0.8%. So it's a kind of surprising to see how the wealthier countries have more higher values of mental disorders, higher prevalence of mental disorder. And but we were surprised, but not so much, because we know that there are some reasons for this differences. I just want to add that these values come from the prevalence of mental disorders come from the global burden of disease study, and so obviously that there is a urgent need for evaluating mental health in the most vulnerable countries. It's very important to detect mental disorders in these countries. We obviously that we have a correlation among the 9 index and the incidence of mental health. So that there is, we believe that there is also lack of data. and also poor knowledge, a lower level of mental health literacy, both among health professionals and the general population. There is a lot of stigma that also occur, and especially in low and middle income countries, stigma attached to mental health. There is a lack of mental health services, and also data systems that are not well developed, and the taxes of the rates of psychiatrists, which is the differences are very high. So, for example, in New Zealand, we have 28 psychiatrists per 100,000 people, compared to 0.1 and 0.5 in Guatemala. In Sudan, 0.1. And so obviously that we with more psychiatrists, we have more higher levels of mental disorders. And as we see here that these are the some kind of stratification of the prevalence of mental disorders by the level or income level, and you can see that the difference is very clear. So it's important, we believe, that to increase mental health literacy, we have some interventions that are indeed very, that are trying to approach this question, because in countries that we have 0.1 or 0.5 psychiatrists per 100,000 people, we must have other professionals involved in mental health, and even the less skilled professionals, health professionals. So we have the MH gap, which is a way of trying to address this by doing task sharing and task shifting, and so moving the mental health detection role to less skilled health professionals, and not only doctors, but also nurses and technicians. And this is very polemical, but is certainly a way of trying to think about how to help these people who certainly that there is a huge gap of people that are not detected with mental health. And so we discussed a bit about the global situation, and obviously that me and other people from geopsychiatry group, especially Julio Torales, who will be talking, I think, tomorrow here. And but me and Julio, we were when we looked at the Latin American data in the global report, we found that this data did not reflect exactly the situation in the region, because we had a lot of other countries that were in a very high vulnerability situation. And so we designed another study to just evaluate the CAPE index in Latin America. So in Latin America today, and I'm going to now on, I'm just going to talk about Latin America. We have 33 countries, and we have countries in North America, namely Mexico. We have countries in Caribbean, and we have countries in South America. We have also 15 dependent territories in the region, and in the region of 670 million people, with almost 22 million square kilometers. So who are in Latin America? Who are the people in Latin America? The people are people that shared in the history experience of slavery, indentured migrants, conquest and colonization by different countries like Spain, UK, Holland, Portuguese, and also France for centuries. And these were followed by movements of independence. These movements start from early in the 19th century and onwards. So we still have some territories that are dependent. So we have territories dependent from UK, the Netherlands, France, and also the United States more recently. And which are the countries, the most populous countries? There are some countries that concentrate the vast majority of the population in the region. We have Brazil with 213 million, followed by Mexico with 126, Colombia with 51, Argentina with 45, Peru with 33, and so on. These are the most populous countries. We also have Haiti in the end of this list, just after Honduras with 10 million people. This information is important because Haiti is a highly vulnerable country, and we are going to talk more about Haiti in the further slides. So the region, after several years of low growth, the economy is facing a new setback as the with COVID and post-COVID situation. We had some external shocks, like the 2008 crisis, with really impacted the region. We had lower demand for commodities from developed countries, which is also affecting during the COVID, which affected a lot the region. We had a lot of flight restrictions. With these were very, very heated. The main activity in many Caribbean countries. So it was a very, very difficult situation during COVID. There were also people that were facing some financial crisis before COVID, some countries. And there were also some the endemic situation of Zika virus in the region, very high levels of informality in work. And we also have a lot of people that live in Latin American Caribbean that rely on remittances from people that are living in other wealthier countries like the US, or it's the most common, but also in other countries, and that send money for their families that are still living in the region. This is really common, unfortunately. So in 2022, there was a restart of the economy, but some scars of the pandemic remain. There is a urgent need for a more dynamic, inclusive, and sustainable economic growth. The region also, in the geopsychiatry perspective, suffer a lot from natural disasters. It's not the only region that suffer, but there are some important topics and aspects here. We have around a quarter of the 8.0 plus earthquakes in the region. We have a lot of floods. Brazil is one of the top countries for floods in the world. We have 20 on average. We have 20 earthquakes, 7.0 plus since 2013. We had 17 hurricanes, and some Caribbean countries, for example, in the last year, lost 25 to 50% of the harvest because of the drought. So it's a region that suffers from natural disasters. And how are these people regarding health, regarding burden in terms of here we have the data from the Global Burden of Disease study, and we see that the difference between the global trend and Latin American trend is diminishing through the decades. And one of the reasons for that, coming to our field, is the increase of mental health importance. So mental health disorders are climbing up the ranking. If we look at the difference between 1990 and 2019, we have mental disorders in the 60th position here compared to the 90th position in 1990. And here we can have a good view of the mental health situation in terms of seeing the difference between the global rate of DALYs regarding mental health and the Latin American curve. So the distance increased, especially during the beginning of this century, and has been kept during the last decades. So DALYs, just for people who are not familiar, DALYs is a metric of burden, obviously that are not only for mental health, but for all type of diseases. And it includes the burden regarding earlier deaths, so years lost, and also the lower disability, so a higher disability, and the years living with disability. So is a very is a valid metric, and so here we are presenting the metric for mental disorders. So the idea was to explore the vulnerability in these countries in Latin America, to identify which are the countries that should be prioritized for aid. This was the first time that somebody used CAPE to try to really focus it on Latin America. So these are the 9 indexes that you already know. So we used the same framework, and here we have the results for our countries regarding the ranking, and I'm going to make your life easier, and I'm going to highlight for you which are the most countries. Obviously, that you were seeing Haiti here as the first in many of the items here, but I'm going to make your life easier and select the most important countries. So Haiti, as I said, it was it had the first position in the vulnerability index in Latin America. It was first in many of the items, and also second in the refugees and also corruption perception index. So how is Haiti? Haiti is a former French colony, and since the 30s was led by autocratic rulers. It was named as the poorest country in the West many times, and it suffered in 2010 with an earthquake of magnitude 7.0, and is a very populated country. It has around 10 million people living there, and the main ethnic group is Black, which the vast majority. Official language are French and Creole, and main religion is the Christianity, and the life expectancy is really low. We have 62 for men and 68 for women. The second country with most in the ranking was Guatemala. Guatemala, together with Haiti, also appeared in the global report of CAPE. But Guatemala, as you see here, is present in the top 10 for almost all the items here of the CAPE. So how is Guatemala? Guatemala is a former Spanish colony. It was a region that was under the influence of the Maya civilization. And it has a very populated, around 17 million people living. The main ethnic group is the Mestizo, which is a mix of Amerindian and white, with an important Maya minority. And the languages are mostly Spanish, but also Maya. And the main religion is always Christianity, but the life expectancy is significantly higher than Haiti. The third country was Honduras. Honduras scored a period in 5 of the top, in the top 10 here in the Cape. So Honduras is a Spanish colony also, and in the last decade suffered a lot from natural disasters. It had important immigrant efflux, but it still have a large population with around 10 million people. And the main group is Mestizo, with also with important Black and Amerindian minority. Official language is Spanish, and main religion Christianity, and a higher life expectancy with 78 for women and 71 for men. Guyana also appeared here in 5 of the indexes. Guyana is a former British colony, is the only English-speaking country in South America, and it's still a member of the Commonwealth. It has a lower population. It's around 800,000 people. English is the main language, but we have also other idioms as well. A mix of religions, but of lower life expectancy, closer to Haiti. The 5th position, we have Suriname. Suriname appeared 5 times. And Suriname is a former Dutch colony with around 0.6 million people. A lot of descendants from African slaves, but also works from India and Java. Varied ethnic groups. The official language is Dutch, and there is a mix of religion with predominance of Christianity, but it has a higher life expectancy. It's good to see that we have, independently of the former colony origin, we can have a higher vulnerability situation. Other countries that appear in the ranking, we have Belize, we have Nicaragua, we have Venezuela, we have Bolivia, and also Dominican Republic. So what we do with that is not exaggeration to say that the world is facing a number of crises at the geopolitical level. We are living, especially these last years, from the current COVID-19 pandemic, along with the increase in population, to climate change, human-made and natural disasters, ongoing conflicts leading to mass migration, increase of refugees and asylum seekers. However, the impact on mental health is still kind of invisible. the mental health scars are not taken into account. Even with the spread of infectious diseases and really the infectious diseases are important, and we are not saying that they are not important, but most of the times we have a lot of focus on infectious diseases and less focus on other kind of problems, and namely mental health, for example, but not only. And so the idea is to start to give more attention to these questions. When we look at the external aid received in our ranking, this external aid received is a tax by population. We don't have the most, the countries that are in the higher needs receiving the higher amounts of aid, external aid. For example, Haiti is not here. We also don't have Honduras here. So it's important to pay attention to these most vulnerable countries. When you look at the percent of DALIs, we see that, for example, Haiti have a very low percent of DALIs compared to the other countries, and obviously that infectious diseases are occupying a lot of the percentage of the DALIs, but we cannot forget that mental health is there. Mental health disorders are there. And so when we look, and you can see here and say, oh, IT is not suffering from mental health, and this is not true indeed. Even with a very low developed mental health detection system, IT, when we look at the rates, we see that IT is more or less together with the other countries and is not the country in the lowest position. Honduras is in the lowest position here, but IT is suffering from mental health. We can imagine that if we have more and more approach, probably this will be even higher. So we can look here and see that Latin America has more or less the same position for mental disorders. This is the Global Burden of Disease study in the ranking for the percent of DALIs. But when we look at the most vulnerable countries like Haiti, Guatemala, Honduras, mental health is more in lower positions of the ranking. So the idea is not obviously that there are other important diseases occurring in these countries, but the idea is not to forget mental health. For example, here we see that in Haiti, comparing the trends from 1990 to 2019, we have an increase in the position of mental disorders, but is still in the 11th. So on a global level, we have human rights violations are perpetually experienced by individuals with mental health. In many middle and low income countries, they do not have access to the basic mental health care and treatment required. The only care available is on psychiatric old style institutions, which are most of the time inhuman, and there are people living in very degrading conditions. There is also certain cultures and religions that view mental illness as weaknesses, and those diagnosed with mental disorder are sometimes deemed as unproductive or unable to keep a family. And this kind of views are unfortunately more common in these countries. So there is a important question regarding stigma of mental health, which we should certainly approach. There are difficulties with seeking professionals help. So, and this is something that should be taken into account. Internalized and treatment stigma, and we know that this stigma is especially important in ethnic minorities, in youth, men, military people, and also among health professions. So you must be asking yourself, so, but occasional, you were talking here for a long time and about vulnerability, but what should we do? What should governments do? So I believe that governments should seek scientific-based measures in order to adequate their own mental health services to the new and adapting situations, and as well as to the cultural background and structural stigma that exist in their societies, and to be able to order a more to offer a more feasible mental health care to their population. What should aid donors and ONGs do? I believe that it's important to recognize the most reliable groups acting in these most vulnerable countries. This is not an easy task, but it's important. And historically, as a result of Basaglia impact on in the region on politics, and Latin America has moved from an asylum-centric to a community-based care structure, and this is very desirable. So it's important that the mobilization of the society in favor of this community services and the activation of the asylums. Obviously that it's important to do it gradually, because otherwise people are just going to become disassisted. A good example of that is the psychosocial care centers in Brazil, the CAPs, in which we can have, these are community mental health services. And we have briefer hospitalizations up to 15 days. There is a possibility of people to stay during the day in the service if they need, or to pass the night, but just briefly. And this, we believe that is a very good example of how to move to this asylum-centric mental health system. The CAPs can help in this, in a psychiatric emergency overcrowding, which is something that was attested, for example, in Brazil. We have a lot of people that with the activation of when we have less asylum institutions, these people start to be more time in the psychiatric emergencies, and CAPs could be good community health, mental health services could be good services to receive these people and compare it to asylums. So it's a good way of dealing with this situation. These community health services and Basaglia impact also culminated with a decline in stigma, which is highly desirable. So Brazil is somewhat a good example in these terms. Last, I think this is my last slide. What should we do as psychiatrists? we believe that psychiatrists should be mental health advocates, engage more with families and communities, try to stimulate this kind of community mental health services. Just we talked about CAPS. We believe that contemporary psychiatry is one of the parts of the social justice. So it's a right of the people to have a good mental health care. Psychiatrists should also offer the best care available, and do not be dismotivated, and try to do the best they can, even in lower resource settings, which is not so easy sometimes. But also try to educate their patients for helping them to advocate for their health, and do not be in a situation, in a position in which like doing nothing. So I really believe that psychiatrists should be more advocates in some kind of services, trying to engage more with people and families and communities. So this is my email. I hope you had a good time in this hour, and I'm open now to questions.